We're now going to look for tethered oral tissues of the tongue, the lips, and the cheeks. If these tissues are short, tight, and constricted, or in other words, tethered, they can influence or restrict the range of motion and function of the tongue and the lips and the facial muscles in general. They can limit the ability to obtain and maintain ideal oral posture and movement, which, as we've talked about before, can have a cascade of events influencing feeding, breathing, sleep, oral hygiene, and potentially facial growth. This test specifically is very important to do in infants and young children because there are several tests that we've already done so far that these children and infants cannot do. So we get a lot more information out of this passive assessment. The first one we're going to do is lingual. So if you're doing this on yourself, you don't really need a mirror. You can base it off of feel. If you're doing it on your child, have them lie on their back and just relax in that position with their mouth open. So you're going to lift your tongue just slightly off the roof of your mouth, and you're going to swipe your finger side to side at the base of your mouth. So it will look like this. Okay. What you're looking for is, do you hit a roadblock in the center of tight tissue that doesn't allow you to smoothly move your finger side to side? With infants, you will definitely feel this restriction if it is present. Now, yes, we expect potentially a little bit of a road bump, but there shouldn't be more than a little. I know that's very subjective, so do your best with this one. And then the next is we're going to look at labial, which means lip. And you're going to go bottom lip side to side. What you're assessing is that center tissue, okay, which is your frenulum of your lip. You're again looking to see, do you hit a roadblock that doesn't allow you to smoothly go side to side? So same thing up here. You're looking at this tissue in the center, going side to side. And then the last one is buccal, which means cheek. And you're gonna go all the way up into the cheek and go forward and back. So here and here. Same thing with the bottom lip. Here, here. Now, if you were in a myofunctional therapist's office or potentially a dentist's office, they would do a little bit more of an in-depth assessment, especially the lip tie. They would look at the distance of where the attachment is from the tip of the gum. I'm not going to get into that for now because I think you're going to get enough information just by having your finger in the mouth and swiping side to side, just feeling that restriction. If you were hitting roadblocks and you notice that the tissue is pretty restricted, then write that in the comments section of your assessment form. If you don't have an assessment form yet, please enter your email address in the link below, and a full myofunctional therapy assessment form will be emailed to you. And that way you can follow along as you do these tests on yourself or on your child. And then if you have any questions with this test or any of the previous ones we've went over, then please enter your question in the comments section below, or you can find me at summerspt.com, or you can reach out to your local myofunctional therapist.